So, coming to shock. What is shock basically?
No.
It is inadequate tissue perfusion, sir.
Very good.
Yes.
It is inadequate tissue perfusion. Inadequate tissue perfusion. Inadequate tissue. The tissue is not perfused, leading to what does this lead to?
Apply.
It leads to cellular hypoxia. Okay. Whatever you told is right. Inadequate tissue perfusion. The tissues are not perfused with adequately with blood. Okay. That will lead to cellular hypoxia. Okay. The cell is not able to
receives poor oxygen.
Yeah, to do pure oxygenation. Poor oxygenation. Okay. So this is the basic definition. And what are the types?
Cardiogenic, hypovolemic.
First of all, it is hypovolemic. Okay. Hypovolemic. Then
Traumatic.
Cardiogenic.
obstructive,
Septic.
distributive,
Neurogenic.
neurogenic,
And septic.
Hypoadrenal shock as well.
septic. Yeah, it is a part of distributive. Hypoadrenal and endocrine shock is a part of distributive shock. Okay. So basically, whatever is this, see, hypovolemia. What does happen in hypovolemia? There is decreased circulating fluid volume in the body. Okay, there is decreased circulating fluid volume in the body. So what happened to the fluid?
Hypotension will be happening.
Sorry?
Hypotension will be there, sir. If
Hypotension.
Sorry, I did not get you.
hypotension will be there, sir.
Yeah, hypotension will be, no, I am telling hypovolemic shock. The first type of shock we are going to talk about is hypovolemic shock. Here I am telling you the circulating blood volume is decreased. So why did the circulating blood volume decrease? So what are the causes of hypovolemic shock?
Trauma.
Intravascular volume
Blood loss.
decreases.
Yeah, blood loss. Yeah, blood loss. How?
Yeah.
Blood loss due to
Bleeding.
Trauma.
Bleeding trauma.
due to trauma or due to surgery,
Vomiting
post-surgery.
diarrhea.
Yeah, due to some hemorrhoids. The patient will have hemorrhoids. He is losing loss of blood. Whatever it is, this may lead to decreased circulating blood volume and the patient may develop into hypovolemic shock. This is the first one. Okay. And second one, and not only blood loss, but even dehydration. The patient's fluid is gone. He is having a sunstroke. Fluid is lost. So then also he will experience the same hypovolemic shock only. Okay. This is the point number one. Then septic shock. What does this septic shock mean?
Arises from sepsis.
Yeah, arises from sepsis, infection.
and
Okay.
circulation.
Septic shock arises from infection.
So it's a
Okay.
hypotension which cannot be corrected by fluid resuscitation. So
See, septic shock, it is due to gram-negative organisms, encapsulated gram-negative organisms. They cause endotoxic shock. Okay. So see here, this is the blood vessel. Suppose this is the organ, tissue. In circulating blood, in hypovolemic shock, what happened? There is decreased blood supply to the tissue. Okay, because there is decreased blood volume in the circulation. That's why there is decreased blood supply. Understood? Yes, no?
Yes,
Yes.
sir.
So, whereas in septic shock, there is the tissue, blood volume is normal, blood volume is good. There is high blood volume. Okay. Even then, the tissues are not getting perfused. Why?
Because of the
there's diffuse
organ
endothelial injury. That's why.
Yeah, diffuse endothelial injury. Okay, partly right. So, what will happen?
Lead to progressive vasodilation.
Very good. So, what happens is in septic shock, there will be endothelial injury. Okay, this blood vessels endothelium will be injured. So, two things happen here. One is the blood vessels will be leaky. Okay, the blood vessels will be leaky. Okay, they are allowing a lot of fluid to seep away. That is reason number 1. Reason number 2 is the blood vessels will be grossly dilated. Okay, so normal blood vessel, the blood is flowing. If it is dilated, the blood will remain stagnant there only. Okay, the blood vessels are becoming dilated. That is point number 1 because of this endotoxins. And point number 2, the endothelium is damaged and there will be leaking of blood, seeping of blood through the vessels. So there is again decrease tissue.
There is organ hyperperfusion.
Yeah, there is decreased tissue perfusion. Okay. So this is the other thing. Definition.
So it is a mechanism of inflammation also.
Mechanism of
inflammation.
Inflammation is sepsis and inflammation. Both are almost the same. Sepsis is infection. It is also a type of inflammatory shock only.
Yes.
Okay. And the most common is the most common type of shock is
Hypovolemic.
Hypovolemic shock.
In this again, hemorrhagic shock due to blood loss. Hemorrhagic hypovolemia may be due to any reason, even in acute gastroenteritis, okay, or severe vomitings, gastric outlet obstruction, hemorrhoids. All these cause hypovolemia. But hypovolemia again, the most common is hemorrhagic shock. Okay.
So the most common is hemorrhagic shock also.
Hemorrhagic shock. In hypovolemic, hemorrhagic. If they ask you what is the most common type of shock, it is hypovolemic. In hypovolemic again, it is hemorrhagic due to blood loss.
Okay.
Sorry?
Okay, sir.
Yeah. So in hemorrhagic shock, there are 4 classes. See, class 1, class 2, class 3 and class 4. What are these classes is depending upon the blood loss, amount of blood loss. See, in class 1, there is less than 15% of the, normally how much blood is there in the body?
5 to 6 liters.
5 to 5.5, 5 to 6 liters. Okay. So around 15% of the blood is lost. That is class 1. 50 to 30% of blood is lost. That is class 2. 30 to 40% of blood is lost. That is class 3. More than 40% of the blood is lost. That is class 4. Okay, depending upon the blood loss. And see here the mental status of the patient. If class 1 patient, he will be anxious. He will be little more anxious. And class 3 will be confused and anxious because of the advanced baroreceptor activation. And class 4 will be, he'll be confused and he'll be lethargic because 40%, almost nearly 50% of the blood is lost. He'll be confused and he'll be lethargic. This is another point. And look for the BP and pulse. The pulse is tachycardia more than 100. In class 2 also it is more than 100. Just go through the table one.
So in all cases, it's tachycardia, right?
Sir isn't there. He asked us to go through the table.
Okay.
Okay, so where the pulse, if it is in class 1, it is more than 100. In class 2 also it is more than 100. And class 3 it is more than 120. Class 4 it is more than 140. Much of the blood is lost here.
So class 1 is less than 100, right?
Which one?
Class 1 is less than 100? Or?
No, it is more than 100 only because there is at least 15% of blood is lost, right? So the patient will start having tachycardia. BP is normal, but pulse will be tachycardic only.
Okay.
So in all cases, the patient is tachycardic, no, sir?
Yeah, every case, see, there is some amount of bleeding, the patient will be obviously in tachycardia. Okay, but the amount is, see, is 100 is okay, little 100 is just above 100, and he will be 120 and 140 is little higher. And see the BP, it class 1 it is normal, class 2 also it is normal. Class 3 and 4 it is started decreasing. Class 4 it is grossly decreased. The patient will have hypotension. Okay. So these 4 points you have to remember from this topic, from this table. Less than 15, 15 to 30, 30 to 40, more than 40. Okay. Yes.
Yes, sir.
Yes, sir.
So we have a shock patient with us, hypovolemic shock. We have started resuscitation. We are giving fluids. What is the most common fluid is?
Ringer lactate.
No.
Oh,
Here the
NS,
fluid is
NS.
NS, normal saline. In burns it is ringus lactate. Here it is normal saline. Okay. You are giving NS. So the best indicator. What is the best indicator that you are giving adequate fluid?
Urine output, sir.
Very good. Urine output is the best indicator. Actually, the question is little wrong. So if they ask you the clinical indicator, that is the urine output, clinical indicator. But the best indicator is you have to know the pressures of the pulmonary capillary wedge pressure. We call it as PCWP. That is that will give the exact idea of the resuscitation. So that is best indicator. If the question is asking about best indicator, you go for pulmonary capillary wedge pressure. Otherwise, clinical indicator, you go for urine output. Okay?
Okay.
Yes?
Sir.
Okay. So, what should be the minimum urine output? It should be more than 0.5 ml per kg per hour. 0.5 ml per kg per hour. So, if it is 60 kgs, the patient's weight is 60. So, the urine output should be 30 ml per hour. Okay? Yes, no?
Okay, sir.
Okay. So now coming to
So
blood
what
transfusion.
if the patient, one question, sir, what if the patient is in like altered sensorium, if the patient is not at all in their original state and they are
In that
vitals
patients
are
also we have to
what kind of
resuscitate.
shock
The
could you think about?
resuscitation protocol won't change. We have to put a catheter, we have to put the IV lines, we have to give fluid. If he's lost blood, we have to give packed cells. Okay. So, and once the blood volume is improving, his general condition and mental condition also will improve.
Okay, sir.
Yeah. And
Sir,
coming
in
to
which condition we have to give ringer lactate or normal saline?
in normal saline, in shock, it is always normal saline. In hypovolemic shock. In burns, it is ringer's lactate.
Okay, sir. Okay.
Okay.
Thank you.